Today we're going to look at some seated exercises for my neuromuscular patient. Because shoulder depression is the first step to shoulder flexion, I'm going to begin with some shoulder slides for my patient. I'm going to place the ball here and ask the patient to roll the ball to the floor. Push it, push it, push it. Good. Good. Try to stay upright and just use that shoulder. Good. While our patient is sitting in this position, it's an excellent time to gauge how much ankle dorsiflexion they have. If our patient is lacking any, we can go ahead and do a quick gastroc stretch. Straighten your leg. Pull your toes to your nose. Good. We would of course do that at least 30 seconds 3 times. From here, we're going to begin working on weight shifting activities. In order to encourage my patient to weight shift to her right side, I'm going to elevate the left pelvis. Notice now that her left trunk is shorter and her right trunk is more elongated, like a C. If patient is lacking range of motion to get there, we can do the same stretch we did in the previous video over the Swiss ball. Here, the patient's ribs are opening, which makes breathing easier, and she's getting a nice stretch to her QL. Now that our patient has had her pelvis elevated, we're going to begin reaching to try and unweight that side. The reaching activity we chose today is having our patient touch her birth date on the calendar. Go ahead and reach. Reach, 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 reach. Good. Reach, 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 reach. Good. Make sure to cue the patient, reach, 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 to go past the point where they can't, so they really activate their QL and engage their core. Patients who are lacking upper extremity motor control should be able to perform tasks such as touching their nose with alternating arms. Also, having your patient touch an object outside of their base of support with alternating arms. Patients who are lacking motor control of their trunk may have a hard time sitting unsupported. As a therapist, you can sit behind them on a TheraBall, pressing it into their back, putting them into an anterior pelvic tilt. From here, you want to make sure that you have another therapist in front of you to guard the patient in case she falls. Now we can allow the patient to find balance in her trunk. Put your arms up like this. Okay. And remembering that we can progress from a very stable position to a more dynamic one. Reach for Brenna's hand. Reach for Brenna's hand.